So as we think about the situation right now in terms of healthcare, and I would speak beyond Greece, right, in Europe, you can appreciate that we have an aging population, you have a rise in non-communicable diseases, and this creates a lot of pressure to our healthcare systems around the world. And we acknowledge that right now those budget pressures are even further strained with a pull on increased investments in defense as well as energy. So this fiscal space is getting smaller. So how do you solve for this problem? And I think that first we need to think of innovation very differently. If we continue to think of innovation in annual budget cycles, we'll always think of it as an additive to the cost. And you never will be able to realize the long-term gains that innovative medicines can provide. So what do I mean by that? We know that with early treatment, early diagnosis, you can then help patients achieve their outcomes faster, better, right? They become productive members of society. There's a decrease in the burden to the system, so it can realize cost savings to the system. And you also realize that family and caregivers are also freed up in their time, causing earlier gains in terms of productivity. And many independent studies have shown that €1 invested in innovative medicines leads to a return of €6. And so this requires a shift in terms of how we think about healthcare, not as a cost or a burden to the system, but an investment. Secondly, I would say here in Greece, it's going to require us to move away from fiscal cuts to thinking about structural reform. We acknowledge that budget is limited. We don't have endless amount of budget. However, we need to use the budget that we have very wisely. And this requires a need for creating structural reform that really allocates resources where you can have the greatest impact on patients. So we need to move into a health technology assessment that moves us into a value-based framework, which the ministry is actively working on. And I think that's really important so that we ensure that we're not unilaterally applying the same discount or payback and looking at really what are the medicines that are driving value and recognizing that value in the conversations that we're having. We also need to abolish 511. So some of you may know in Greece, we wait for 5 countries to get reimbursed before patients get access to those medicines. And I think with the implementation of HTA, it's going to be really important that we abolish 511 so that patients don't have to wait so long for that access. And the last thing I'll speak about is shared responsibility. Right now, we're in a system where there is a lot of uncertainty in terms of what that payback will be. And unfortunately, the industry over the last couple of years has been paying more than the state for pharmaceutical innovation. And the latest numbers show that in the hospital segment where there is most of the innovative medicines, you're at a payback rate of 81%. Of course, this is not sustainable. So we do need to find a solution together. We need to figure out how we rapidly put these structural reforms in place so that we can control pharmaceutical expenditure, but also ensure that the innovative medicines that are bringing value to patients and improving patient lives are being made available to them in a very timely manner.